debate about alternative medicine has increased. Its advantages in the treatment of many diseases which affect people have been highlighted, and these kind of medicines have become more common than conventional ones, spreading increasingly all over the world. About 80% of the African population use alternative medicines. In France, the number of patients who have tried these type of medicines for the treatment of pains and relief from diseases, at least once, has reached 75% of the population. In Germany, the figure is about 77%. In Britain, this medicine costs about $2,300 million American dollars yearly. The World Health Organization has offered a wide work strategy formula for alternative medicine between the years 2002 and 2005. One of its clauses states that officially recognizing alternative medicine helps states to improve policies and programs for it. The WHO has classified 43 pathological conditions which may find effective treatment from alternative medicines such as cupping. These include osteomuscular injuries, alimentary disorders, respiratory infections and gynecological health problems. The study, carried out by a recognized Syrian medical team on cupping in 2000, is considered the initial nucleus which attracted the attention of a lot of universities and researchers worldwide to this genuine medicine. They discovered the advantages of this therapy and its accurate scientific laws, first outlined by the eminent humane scholar Mohammed Amin Sheikhoun. There have been positive clinical results for some hitherto incurable diseases such as haemophilia, migraines, hypertension, cancer, Buerger's syndrome, which has only ever been cured by cupping, diabetes, arthralgia, sexual weakness, sterility and other diseases. In the year 2000, 300 patients were taken in addition to a continuous study intended to span more than 10 years. This study encouraged further ones. So, in 2003, there were a further 600 studies conducted.
The Syrian medical team use scientific methods which are definitely reliable in studying the results of cupping. They examine the patient and take a blood test before and after the cupping. A significant difference has been demonstrated between the blood test before the cupping and that after it.
The continuous medical study and the positive results evoke admiration and amazement from the medical establishment. Among the last patients, we should mention the muscular and articular diseases, hypertension and diabetes. The success rate for cupping was 80% for the diabetes conditions, from a total of 73 patients, and 91% from 172 patients in the case of musculo-articular conditions. As for migraine, 52 case studies were conducted and the success rate was 94%. It was 90% for 74 case studies of hypertension and 90% also for 19 cases of haemophilia. The medical team has confirmed that the improvement shown by the patients suffering with haemophilia in particular could be considered a scientific marvel. There were also many other diseases that showed positive results, but with a slightly lower success rate. To better acquaint people with the medical cupping operation, its procedures, latest developments and results, practices and malpractices, the Islamic scholar and thinker Mr. Abdul Qadir al-Dirani and the members of the Syrian medical team who direct research into cupping have produced this documentary about it.
From a medical point of view, cupping is a simple piece of surgery performed on the upper part of the back of the body. It aims to purify the body from all poisons there. The body becomes more active after cupping, and both its immunity and ability to be cured itself are improved.
Regarding its history, cupping goes back to ancient times as the prophets and messengers recommended it. It was applied by Pharaoh, who possessed great medical knowledge and recognized its advantages and benefits. Some pictures of the practice were found on the walls of the tomb of King Tutankhamun. The ancient Greeks knew of it, and it became widespread during the age of Hippocrates, the pioneer of Greek medicine. It continued to be used for many years and was known in France. Some people used it well, but others did not observe its rules.
In fact, cupping had drawn my attention when I was young, as I was fond of reading. I read literature and history about princes, kings, and chieftains who were also interested in cupping. They singled out a day of the year on which they used to go to orchards, and a man would perform it for them within special, fixed and well-known rites.
The practice really took off in Islamic times when the Prophet spoke about it as well as demonstrating following its amazing rules. However, many years after the departure of the Prophet, the rules of cupping began to be forgotten due to negligence and carelessness, until it became obsolete except for the occasional piece of information. It was discredited by those who took against it, and people stopped practicing it. Although a few individuals maintained the method, they were not able to get the results they wanted, and sometimes no benefit would occur at all. This happened because they were not applying cupping according to strict scientific conditions of simple surgery, since the rules had been forgotten. They applied it in winter and summer, following physical exertion and tiredness, after eating, and not in the right position. However, the late Syrian scholar Muhammad Amin Sheikho brought this sunnah to light again when he revealed its rules and its strict scientific conditions in his book, and pointed out the right position on the body, as well as uncovering the secret of the machinery of this cure, which rids the body of unhealthy blood.
In the name of God, of the compassionate, the compassioner, the idea of producing a medical book related to cupping was suggested to collect supporting data from medical reports and laboratory tests. Although there are already many books about cupping, This one examines in more detail the scientific rules and procedures of cupping, which the eminent humane scholar Muhammad Amin Sheikho has derived from the Honorable Prophetic Sunnah, under the management of the scholar Professor Abdul Qadir John Ad-Dirani. Nur al-Bashir Bookhouse first suggested compiling the above data in a single collection, which included information on the efforts of the medical team in recent years, under the title of The Marvelous Medicine, Cupping, a Medical Science in its New Perspective. Accordingly, these studies and data are now accessible for those who need it and forms a primary nucleus for new studies about this important scientific branch.